Inspiration. Today, Good for Utah's Nadia Crow begins the series with a new technology that checks for liver disease.
This is the liver, a large organ that doesn't get the spotlight.
It just quietly does a lot of important things. It mostly processes the food that we eat. The nutritional value that we get out of food is often handled and processed by the liver. It's important for lipid regulation, heat generation.
Something most of us don't pay attention to unless it's threatened or stops working. The leading cause of liver disease is hepatitis C.
I had received some transfusions 50 years ago, and that must have been when I contacted the disease. But I've never felt any effects of it.
But doctors wanted to monitor Bryce Olson's hepatitis C and its effects on his liver, so they did multiple liver biopsies over the years.
And the liver biopsy is like getting slugged in the side. They stick a needle between your ribs and pull out a piece of your liver and biopsy it.
Many people are afraid of needles, and if you don't like needles, you're really not going to like liver biopsy because it's a bigger than average needle.
The alternative is a Fibrous CAN. A wave is passed through the small transducer on the end of this ultrasound probe.
You'll feel a tap right now. And with that, we see an image of the shear wave that's moving through your liver tissue.
After 10 measurements,
we take an average of those readings to give us the liver stiffness and thereby the scarring or fibrosis that the patient's liver has.
It's a painless procedure with no needles involved.
How are you feeling?
Dr. Michael Charlton, medical director for liver transplantation and hepatology at Intermountain Medical Center, says it's more accurate than a biopsy.
You only get about 1/50,000th of the liver with a liver biopsy, so you get a very small piece. So there's some worry about is what you get an accurate reflection of what's going on in other parts.
The Fibrous CAN covers 95% of the liver, and it's cheaper than the biopsy. Take a look. A biopsy costs about $5,000. A Fibrous CAN, $400 to $500.
I have some hepatitis C.
And for Olson, who's had hepatitis C threaten his liver for 50+ years, no more frequent biopsies. Now, only the Fibrous CAN.
It was painless. I mean, it's easy. There's no fear, no problems. You just have it and go merrily on your way.
And that was Nadia Crow reporting. Now, Dr. Charlton says patients come from surrounding states to use the Fibrous CAN machine at Intermountain Medical Center in order to avoid a liver biopsy. He says most people are candidates unless they are extremely overweight or obese.